Hello everyone, thank you so much for listening. We'll be talking about our project looking at the effectiveness of mindfulness training for improving resident wellness and their overall quality of oncologic care delivery. So the aim of medical residency is to ultimately create physicians that can deliver quality care to their patients. And the traditional focus is on building clinical and academic acumen within our trainees. However, all this effort is potentially undermined by a phenomenon known as burnout. Burnout is something that's been reported in the literature, unfortunately by new practitioners, as occurring only a few years into independent practice, and it's thought to be caused by the compounding physical and mental fatigue, leading to a decline in the quality of care physicians can deliver to their patients. Lack of physician wellness has been associated with this, as well as a decrease in empathy. As we know, empathy is crucial in delivering quality cancer care. It's also been associated with a decrease in physician IQ and EQ, and all of this eventually leads to poor patient outcomes. Now, mindfulness training has been shown to improve mental wellness and reduce burnout. So our goal of our study is to evaluate the effectiveness of mindfulness training in improving resident wellness. So the method by which we did this was one, at the beginning of the academic year, we had all our radiation oncology residents as well as our medical physics residents all take a modified but validated in the literature survey for resident wellness. We then also had them complete a Mensa IQ test and 2 EQ tests. This is because EQ testing has been generally shown to be less precise, so one test tends to vary from another. We then had them undergo approximately quarterly a guided meditation session. We are lucky in our institution to have a department of integrated medicine and nutritional science, so we had a professional who goes, sees our patients, see our residents. We also offered them offline resources for regular usage. Finally, we intend to have them repeat their IQ test, repeat EQ testing, take another modified survey, not only to gauge their wellness this time, but also to see how adherent they were to the offline resources and to elicit feedback so we can go deliver a more effective wellness regimen in the coming year. Now, we do anticipate that with our intervention of mindfulness education that we will see increased wellness in our residents and improved IQ and EQ scores. Now, with that, we understand that having them take the same IQ and EQ tests may confound things. And also, from what we've seen throughout the study, just less compliance than we would have liked, maybe a little bias towards the intervention that wasn't anticipated, may lead to poor outcomes than we would have hoped for. But ultimately, we hope the feedback we obtain from this first iteration will help us develop a curriculum that will ultimately equip physicians and residents to be well and to have long, effective careers delivering excellent care to our patients.